Okay. What's up?
Avi. Avi, how many more of these do you have scheduled that are like specifically devoted like for chapters? Do you have like a end date?
Well, not I mean, we're getting there. Why do you are you afraid we're not going to be done in time?
Mildly.
We'll get
We
there. You don't trust me?
no, I could Avi, listen, you know I trust you. It's more so making sure that we hit everything it is that we need to hit. I mean,
We're
either
gonna
way,
hit.
we're happy that you're doing it.
Listen, I'm all about being thorough. We're gonna hit everything. We're
Thank you,
gonna
Avi.
we're gonna hit it all. In fact, there's a lot of things we're gonna hit today. How many? So did you guys have your lunch or dinner today?
Yes.
Let's let's get through it.
Because I don't know if you realize what we're about to look at, but
Is Tangaiasis?
well, it's a theme. Yeah. Very good. Tungiasis. Okay, so
Bugs.
what made you say it's Tungiasis?
Volar skin and just like this is I feel like one of those instant recognitions ones. Like I see all this, like I see the eggs. This is like a pregnant female, right?
Yeah, well, there's eggs in the ovum. Yeah, they have eggs here. You're talking about these things, right?
Yeah, those thingies.
Okay. And what are these thingies? These are trachea. These are these little circles.
Sure.
So let's take a step back for a second, because when it comes to Helminths, we want to like have an organization, like a general organized pattern of approaching these things. Because it's one thing to just like, oh, here like the classic examples, they're going to be tested on the boards, but it's better if you have some kind of flow chart or strategy. So in terms of categorizations, when we talk about these things, we're talking about, broadly parasitic worms or parasites. And the ones that we really have to know about are in several categories. So worm or vermes is an outdated term. The term is no longer in use in phylogeny. Parasitic worms, well, generally, even that is not really the best term for it, but it's generally referring to several different things. The first thing it's referring to are any parasitic helminths, so helminths, which is just a parasitic worm. Again, outdated terminology. That refers to several things. Your annelid family, which are your segmented worms. Your platyhelminthes, which are your flatworms. And within platyhelminthes, there are two subcategories. There are your cestodes, or your tapeworms, and there's your trematodes, or your flukes. And then you have your nematodes, which are your roundworms. So, nematodes, trematodes, cestodes, annelids, and then you have maggots. Nematodes, trematodes, cestodes, annelids, maggots. By the way, what's a maggot? Anyone know? You've seen maggots before. I know you have.
Maggots are like, I wouldn't know how to really categorize them, but they're little bugs that latch on and suck blood, right?
Some of them do. So basically, they're a larva of a fly. It is a larva of a fly specifically. That's different from larvae of other insects, like beetles. Beetles don't have maggots. They have larvae that are called grub. The difference between grub and maggots are specifically larvae of flies. Grubs are larvae of beetles. We have to worry about maggots generally, because those are the fly ones. So a maggot is a larva that specifically will turn into a fly. Okay. And by the way, so which one of those things? Well, this is a tongue of penetrans, and as you correctly pointed out, you notice the eggs, you notice the wall, and you can also notice the trachea. It has several layers. There's an epicuticular layer, which we probably can see well over here. Yep. Here's your epicuticular layer. There's your procuticular layer. And then you have your hypodermal cells, which are right over here. And interspersed between your hypodermal cells, you'll actually have your trachea. They're kind of falling apart over here. So that's tunga penetrans. If you've actually seen, has anyone seen tunga penetrans like grossly?
We had a case at Mount Sinai Queens, I believe.
Oh, you are so lucky. What did it look like? Tell me.
It looked like this like erythematous red brown kind of like ulcerated papule on the foot.
And you biopsied it?
Yeah, it was biopsied.
Oh, so awesome. Okay. Here's some muscle, by the way. I can give you that at least. Okay. So I would have liked to have seen it. Where did you biopsy this? You don't have to actually, don't say right now. It's fine. Okay.
Yeah.
But I'll talk to you later about that. I want to actually, I'll follow up with that. Okay. What do we have here? So let's orient ourselves. So this is
That's the epi. Something very odd lower down, but
okay.
looks maybe, yeah, no, it looks fine. Whatever's going on down there is
Down
abnormal.
where?
In, I don't even know, like the deep dermis, like it's past the reticular dermis, maybe.
Okay, so past all right, so tell me when to stop. So we're going to dermis, reticular dermis, we're in the subcutaneous fat now.
Yeah, I guess it's
Now
in
we're
the,
now
I
we're in the
guess it's in-
muscle.
okay, muscle.
Muscle.
My,
Something's wrong with the muscle?
no, but the fact
Yeah.
that the muscle's in the biopsy says something.
It's okay. Okay, good. That's a good observation. What does it say?
That there was some deep pathology.
Yeah.
And there are some bugs that go into the muscle, so
Okay. Okay, what kind of bugs go into the muscle?
strongyloides.
They can, yeah. Okay, so they can. But what's a classic one that we have to know that really goes into the muscle that like almost? Now I wouldn't say specifically because you can find it in like the brain too in some cases, but what's in fact, you know what? What's this? So this is muscle, right?
Yes.
Okay. What's this?
I have no idea.
Here's another one. Sometimes these
Is that like an occluded? Is that an occluded vessel?
well, we have to be able to tell if they're a vessel or not. So first off, I'm going to show you. So it's good to be able. So one thing that's very important is to be able to differentiate these from normal structures. So these are the type of vessels you see here. So here's your muscular artery, and here's your less muscular vessel over here. Here's like more of a vein. So they have red blood cells inside them. And that's what they look like. That's normal. What about this? Is this normal?
That's not normal.
That's not normal. This is not
Yeah,
in
no,
any of our normal muscles.
no,
hopefully.
no.
Well, it actually might be in some, depending on what you've eaten.
The trichinosis.
Yeah, trichinosis. Very good. So this has a little collagen around it, and this is actually a nurse cell. And it's nursing your little trichinosis.
Mhm.
How do we get trichinosis? Sometimes they can artifact out, by the way, and all you'll get
Is
is like
it
this.
eating bad pork?
That's the most common one, eating bad pork. Now, they've caught on to that on some of the exams, by the way. And they're like, okay, we're not going to ask pork anymore because everyone associates that. So they'll give you, sometimes you may have like an example where like someone's hunting a tiger or a bear or something, and they'll eat that. So those have trichinosis as well. And why do you think they have trichinosis?
Because they eat pork.
Yes, they eat wild boars. They eat pigs. Yeah. Both of them hunt boars, or that's one of the things they hunt. But various uncooked meat. Yeah, it's just more common. And what do you see? What are some of the clinical findings that you're going to look for if you see if you're suspecting trichinosis? So how's the patient going to present? Ooh, they ask us this. So muscle aches, particularly back muscle aches. And what's a lab test that you can see?
CPK.
Yeah, elevated CPK. And it makes sense, right? Look what's happening. It's going in your muscle. Okay. Back to this muscle. Do we see anything in this muscle?
It doesn't look like it from a bird's eye view.
Okay.
It was definitely like a cut. That's all artifacts. What's that right
Uh-oh.
there?
You saw something.
Yeah.
What?
I guess whatever this is that we're zooming in on.
Ooh. What do you think this guy might be?
Is that the actual, like, is it the flatworm or is that
Okay, well, good. So flat. You've noticed that it's flat. So what category does that put you in?
is it tryphanid?
So
Or
platy.
tryphanid?
So we have a phylum for the flatworm. So remember, we have our annelids, we have our roundworms or our nematodes, we have our platyhelminthes phylum, which is our flatworms, which are broken up into our tapeworms, which are flat segmented, and flukes or trematodes, which are flat non-segmented. So you notice that it's flat. You looked at it and you're like, oh, this looks like if I were to imagine this in 3D, you picked up on that. I'm impressed because actually, without knowing what it is, maybe it's round. Who knows? But yes, you're right.
This
So
would
you're
like
the
fall under.
platyhelminthes phylum.
Yeah, it's a flat helminthes and it's segmented. I'm also presuming based off of the shape and
Yes.
body of it.
So then it is. So what class? Okay, good. So then is it a? So what subdivision of platyhelminthes is it then?
It's not the one that's tryphanid. It's the one that you mentioned before
Yeah,
that.
good. Cestode. Yeah, it's not a
Cestode.
trematode. It's a cestode. It's the cestoda. Okay, so it's a cestode. Good. Okay, so what kind of structures are we observing in the cestode? Well, what's this?
It's like small smooth muscle or something
Smooth.
like
Okay,
that.
muscle. Good. It's like a lot of parallel longitudinal muscle layers. Okay.
Yeah. There's like these it's like full of holes. I mean, like the nuclei that's there.
These things you're talking about?
Yeah, I don't know what all those holes are.
That's a very important structure, and you can identify this. It's actually now they like to ask this for this specific organism, but I will just tell you that you can see this in just about every cestode. However, for the purposes of the exam, they like this organism specifically to ask this about. These are called calcareal corpuscles. They are involved in calcium homeostasis.
Solid.
They're involved in calcium homeostasis of this cestode. In fact, without them, the cestode just calcifies and dies. And what do they stain with, by the way? What do you think they're going to stain with?
Probably like Von Casa and
Yes.
alizarin red.
Yes, either one of those. Either a Von Casa or alizarin red. Practically, since we don't do alizarin reds anymore for whatever reason, it'll be Von Casa. And yes, you will light up all these calcareal corpuscles. And so with that, this organism that they love to test the calcareal corpuscles that has this large size is called sparaginum, Sparaginum proliferum, or sporaginosis would be the diagnosis. That rhymes. So you can see these in immunosuppressed individuals that you get these subcutaneous or to submuscular masses. In some cases, it is in the abdomen, axilla. So you can even see them in the groin. there's actually a condition known as scrotal sporaginosis, where they form a nodule of sporaginosis in the scrotum. Really bizarre. But yes. So, but that is the perfect approach, Scott. So you looked at it and you put it in a category. I may not know exactly what it is, but I can categorize it. I can say, okay, well, I can get it into a phylum. I can get it into a class. And then once I do that, I can look and start narrowing things down. That's exactly the approach that I love. I love that. Perfect.
You're welcome, Bobby.
Oh, okay. All right, what happened here?
A dumpster fire.
It's what?
A dumpster fire. It looks not great.
Not great.
Um,
Yeah.
yeah.
The ready ridges look elongated. There looks like there's some maybe edema in the papillary.
Now, when
ductus.
you talk about elongated reedy ridges, do you think if this is going to be like a syphilis picture?
No,
No, yeah.
Yeah, because why do you think you're getting this look?
from
like
the
chronic.
adrenal.
Yeah.
Yeah, I mean, look what kind of cell we have here. Let's note this.
Lots of
What's the
EOs.
predominant cell?
EOs.
Loaded with EOs. There's some other cells, there's newts too, but it's, yeah, loaded with EOs. This is completely, I mean, we get the picture of why it looks like this. There's so much spongiosis. There's so much urticaria going, urticarial spongiosis or whatever. In this case, it's not on the urticarial spongiotic differential, but here's a numerous eosinophils going deep. So you might be thinking, well, is this like an exuberant bite reaction? This even looks kind of intense for an exuberant bite reaction in some ways. Although I have seen some exuberant bite reactions that can look somewhat like this. But I will just say that this is a sad case because they didn't find the worm. And in fact, in a lot of these cases, you don't find the worm. And we'll talk about why not. There's views on that. This was a case of larva, not currens, but larva migrans. What is larva migrans? Larva migrans. Anyone know?
Larva migrans. I thought larva migrans is the one that didn't penetrate the basement membrane zone. But I guess it could give
Sorry,
me
what was that?
I'm sorry, I'm in the gym now, Avi. But for the larva migrans, I thought the larva migrans wasn't the one that penetrates the basement membrane zone, or is that larva currens that doesn't do that?
So both larva migrans and larva currens are basically a migration of a worm, but there's something that differentiates cutaneous larva migrans from larva currens.
Yeah, I thought larva migrans does not penetrate the basement membrane zone. I also thought larva currens.
Well, let's just look at this. If there was a worm here, do you think it is limited to the basement membrane?
Certainly not. No.
No. So they can both go all sorts of places.
Okay.
You can have whether you have a hookworm or whether you have a roundworm, whether you have a nematode, whether it's a microfilaria, they can go places. What's the main thing that differentiates larva migrans versus currens? They test this.
It's caused by a different species of worm, right? There's like strongyloides.
Okay. Okay,
and then
so strongyloides, and by the way, what is strongyloides? It's what category is that in?
I don't know.
It is a nematode, roundworm. Okay, so strongyloides is a roundworm, and what does that one cause?
Strongyloides cause larva currens.
Good. Strongyloides causes larva current. Okay, and then
I think of like for any of your listeners I think of like a strong current. So that's how I.
That's good. I like that. Okay. It's strong, so it causes okay. So it goes fast. Okay. And larva migrans are caused by hookworms, ankylostoma, and it's slower. It migrates slower. That's the main thing that differentiates the two is speed. So I want to show you something. You all see this?
Yes.
Okay. So you're going to differentiate larva migrants versus larva currens. This is what you do. You take the area, you take a little pen or pencil, take a pen really, and you draw around it, mark it. And then look what happened. They came back a few hours later. See that?
So then this would probably be like
this
larva currens,
larva
based
currens.
off like how
This
many
moved
centimeters.
here, this moved there. And so this is a pitfall about biopsying larva currens. When you get asked someone, okay, get a biopsy of the larva currens, what do you think is going to happen?
It's probably going to have like moved from that spot already,
Yes.
right? There's maybe like some
Exactly.
delay.
Exactly. It's already gone. So the way you biopsy this is a stepwise process. The first step is you mark it, because you can't assume where the direction is. Look, if you were to mark this, you'll assume the direction is either out this way or out that way, right? But look where it went. It came out this way. See that? It went this way. Same thing for this one. If you were to just look at this and try to biopsy, you don't know where the direction is. You're assuming, oh, maybe it goes this way, that way. Actually, it went that way. So you have to take at least two snapshots in time to see where the direction is. That's one. The next step is you actually want to biopsy not the rash itself. You want to see, once you have the direction, you go 2 centimeters out of the inflammation in that direction and punch it. If you want to get even more fancy, you could do serial punches out of the leading edge. You can do 3 punches, boop, 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 like 1 centimeter apart. But the point is that strongyloides is not in this area. It's not in here. That's just the inflammation that's left behind. In fact, some people will tell you that strongyloides, well, when you see a whole bunch of strongyloides, there's no inflammation. And then they'll tell you that, oh, I know why. That's because they're immunosuppressed. That's partially true, but that does not account for the main reason. Think about it. If you take an immunosuppressed patient and they get bitten by an arthropod, do they have 0 response at all? No. They usually have something. They mount something. And in fact, in some cases of immunosuppressed patients, they actually have exuberant reactions. What's an example of that, by the way? What's an example of a type of immunosuppression that gives patients an exuberant arthropod response? They test that.
CLL.
CLL, very good. So what's the real reason? The real reason is strongyloides is a very motile organism and will literally run away from the inflammation. It will run away from the eosinophils. It will run away from and so if the eosinophils and inflammation is up top, you're going to look down below where it's clean. If it's left, you're looking right. Ideally, you shouldn't have it in the biopsy if you biopsied it correctly. You can still get it, but if you're going to get it in a biopsy, you probably should look where the inflammation isn't, not where it is. Why does strongyloides run away from eosinophils? Well, as opposed to other things. Well, number one, because it can. So if you compare that to something, say, like schistosoma mansoni, schistosoma hematobulum, cysticercosis, if you compare it to the example we just saw in the muscle, no, they can't move. They're not motile. But also, they're particularly sensitive to something that the eosinophils have. What might that be?
Maybe like major basic proteins.
Good. Excellent. Good job.
Always major basic protein that there's
Major basic protein. It's toxic.
okay.
So that's your major. It's toxic to strongyloids, toxic to helminths in general. But major basic protein, they are very sensitive to that and they will run. So it's a game of cat and mouse. The eosinophils are trying to catch up to the strongyloids, but they're slower. Strongy is just too fast. And so you get these streaks where the strongyloides is not. It ran away. By the time it's already out. Now, certain worms are larger and slower than strongyloides, and the eosinophils have an easier time catching up. Unfortunately, I don't have an example of strongyloides in skin yet, or that I have available to show. So I have to share these massive pictures, of massive larvae of strongyloides. But what I want to share with you is that in some cases, so here's an example of a larva. But so is this. And we'll see some other examples where larvae can be something called microfilaria, not just rhabdidiform filaria, filariform larva or rhabdidiform larva, but there also is a thing called microfilaria. In any case, you should be able to identify this as a worm, clearly. I don't think they're going to give you the super hard examples. They'll probably make it very obvious for you if they do give you that, or they'll probably help you with the story. And what's another finding that you can see, by the way, in the Strongyloides patient, clinically? So we talked about larva currens. Is there any other clinical finding?
Oh, does it go to the lungs at all?
So it does go to the lungs. That's true. In hyperinfections, especially if it's disseminated hyperinfection, Strongyloides hyperinfection syndrome, yes, they will. So it goes to the lungs, and it also goes to
GI, right?
it goes to the lungs even in the autoinfective cycle. So it pierces the skin. It will go to the lungs. You cough it up. You cough it up in the lungs, and then from the lungs, and then you swallow them, and then it goes to your GI. In the GI tract, they mature. They get really large. They grow. So yes, both GI and lungs are involved. And you can get Loeffler syndrome, by the way. If anyone wants a little fun fact.
Oh,
It's
that's
one of the
right.
causes of Loeffler syndrome. Remember that one? Remember that?
I do.
Okay.
I do.
So
Deep in there.
been there, done that, huh?
Yeah.
Okay. So okay, but what other thing? There's a very important clinical finding.
We're asking skin or
Come on, guys.
urticaria.
Like this.
Are you talking just about the thumbprint sign?
The thumbprint purpura, yeah.
Yeah.
Now,
Does that
classically,
come
they
on?
surely-
Does that come on like at the end of the disease course, or when does that come on?
That's an excellent question. I have seen cases where that comes after the larva currens. I've seen cases where that comes before the larva currens, and I've seen cases where that's the only thing you see. Unfortunately, the rash of Strongyloides, you usually don't see either larva currens or thumbprint purpura. It's usually nonspecific. If you're lucky, you will see either larva currens or thumbprint purpura. Now, if you were to biopsy the thumbprint purpura, not the larva currens, but the thumbprint purpura, where do you biopsy?
Like, I'm just randomly guessing, but maybe perilesional, like a little bit of the lesion, a little bit of normal skin.
Aim dead center.
Okay.
If it's thumbprint purpura, aim dead, punch it dead center. And the reason is you're going to get the larva anyway, because what happens is they actually get trapped in the fibrin that's clogging up the vessels. In the fibrin the vasculopathy, they start getting trapped in there and they start dying, and then it's like a whole bunch of necrotic tissue. It gets all gooped up, and the larvae get gooped up with them. You'll get it. And it is a much higher yield to biopsy thumbprint purpura than to biopsy larva currens. Now, part of that is because people don't know how to biopsy larva currens. If people knew how to biopsy larva currens, I'm not sure which one would be more higher yield. But it's much easier to get a higher yield out of biopsying larva thumbprint purpura. Okay. What's the treatment for Strongyloides? They also can ask that as well.
Is it ivermectin?
Albendazole?
Albendazole. Ivermectin.
Ivermectin or albendazole, I think.
Albendazole is second line, my friends. First line is ivermectin.
It works.
Actually not as well, by the way. You would not, if you had disseminated Strongyloides, you'd not want to take your chances on albendazole compared to ivermectin. Even ivermectin is struggling it. And the dosages for different stages are also different. It's not that the dosage is necessarily different. It's the 200 mg per kg daily. It's just that how the regimen is scheduled is different. So for the autoinfective cycle, they give you 4 pills only for whatever reason, typically. But for hyperinfection syndrome, they'll give you just straight up daily until sometimes even until like a negative test. But yeah. Okay. What about this one?
They're all filariasis.
Dirophilariasis. Okay. How do you know it's Dirofilaria? Dirofilaria homina.
A thick muscular layer.
Thick muscular layer. And you see these lateral cords? That's the other thing they have. What else does Dirofilaria have? I mean, it has other things, right? Has this. Has this.
So like a GI tract or a mouth or
Okay, this, yeah, okay. Has a GI tract. What about this?
mood muscle.
What's
I
inside
I
it?
know you're pointing to. Oh, is it like this blood or is it like a spine or?
Not blood. How do things reproduce?
Oh, sexual. It's like a sexual organ.
Oh, it has these are eggs.
Yeah.
It's a uterus. Uterus with eggs in it. That's another thing you see. Okay. What does that look like?
This, I'm between no, not schistosomiasis. These are too big for schistosomiasis. Could it be onco? What, I don't know how to pronounce the word, but I'm picturing the word oncomaderisis. Do you know which one I'm
Let's
talking?
just before we let's just describe what we are seeing. Because we can get there.
See like a pear-like structure.
Yes. What do you think those pear-like structures are?
Are dividing? I don't know. I'm not sure.
Well, there's not cells. You can see something in it that we saw before.
Is it eggs?
Eggs. Yes. So it's a double barrel uterus.
Uh-huh.
Does that ring a bell? Double barrel uterus?
I can't say that it does.
Okay. So it's the wonderful world of parasites, my friends. Okay. The double barrel uterus. Okay. So I think that's Wushiri. That should be Wushiri. Onchocerciasis, actually. No, not Wushiri. That's right. So you were right. Onchocerca. Not Wushiri bankruptcy.
Double barrel uterus is
Wushiri, you'll see filarial larva in it. But in this case, the classical sign is the double barrel uterus for onchocerciasis. Which is not to be confused with onchocercarial dermatitis, which we'll get to. That's something else. But onchocerciasis has a double barrel uterus. This is a gut part. This is the worm. We all see this as a worm cross section. But you can see the eggs. I mean, they look actually very similar to what we saw before. Dirofilaria had these eggs. See? You see how they look all similar? It's not quite perfect for a red blood cell, although it looks similar. But if you look at it here, see that? These are not red blood cells. Okay, so your classical double barrel, you see a uterus, back to back. That should tell you this. You're looking at onchocerca, as opposed to. So actually, one way of differentiating it that I have heard, and I don't know if this is helpful, but dirofilaria,sis, at least the Elstonism anyway, is that it's all muscular and strong, but it's always single. You see how it's all by itself? This one's all by itself. This one's all by itself. But onchocerciasis, here we have some friends. We have our double uterus. Here and here. Here and here. Here and here. But unfortunately, the price of getting married is that we lose our muscle. See how it has no muscle left? It's all weak. That's what happens when you get married. You stop working out. And that's what happened to this worm. Sad, but you know. Okay, what about this one?
It's a shave biopsy, and it
A
looks
shave
to,
biopsy.
I mean, I'm assuming it looks like it's just all like the epidermis or like there's nothing.
Epidermis. What part of the epidermis is this?
So, oh, that's the corneum right there, and then
That's the stratum corneum?
oh, I thought that was a stratum corneum, like, but
What part? Let me ask you this. What part of our epidermis is this?
yeah, is that like the
That look-
lucid?
Looks like a tooth, the teeth.
That looks like it's not part of the epidermis.
Does any part of this look like it's part of the epidermis?
No.
Probably not.
Is this a fungus or an algae or something?
It's pretty large for either of those.
Okay.
Look at how big this is. Let's see. Well, let's see what we can find. We know this thing is large and it has those spines. You see that? That's very
Yeah.
characteristic of this.
This myiasis.
So that's yeah, okay. So and what causes myiasis?
Oh.
What is myiasis?
Fly worm? No.
Worm?
Like, is that a
Or-
bot? The human bot
Okay,
fly is a maggot?
botfly. Okay, botfly what? Is it the fly?
Fly larva?
Fly larva, which is called a
Botfly.
it is a botfly, but it's not the fly, it's the larva. And what do we call the larva of flies? What's the term?
Oh.
Maggot.
A maggot.
Yeah.
Yes. Not a grub, a maggot. Grubs are for beetles, maggots are for flies.
Of course.
So this is a botfly, and so let's go. Just to put this into your botfly maggot. See that? These are botfly maggots.
Oh yeah, this is like on all those like videos I see of people. Yeah, they put like a little bit of Vaseline over top. They'll get a little like
You see the
force that, they'll
spines?
dig the yeah.
See, those are the yellow. Those are those yellow things you saw. These spines.
Ooh.
Those are the
Wow.
spines.
So that comes out on path.
Oh yeah. Well, you just saw it. Here. Comes out on path. Right here. What about this? This is
And are you asking what type of biopsy it is?
Well.
The bunch biopsy. Is that another egg?
So this is an
Okay.
organism. Okay, what are we talking about when you say egg? Are you talking about this, like what?
I don't even know.
Do you guys see it?
I'm lost in this chapter. This is not my chapter.
Well, listen, just you could just have to have a really nice meal. Like, make sure you have your dinner, your breakfast, and then learn it. That's the best way to do it. Anyway. Well, we can see a few things. One thing, look at this cuticular layer. Anything you notice about it?
The little cuticles or
Okay, little what?
It's cute.
Okay, if you were to this jagged spines, like here, see that? Yes, no,
Yes.
yes,
What
spiny.
is it?
Listen, I don't know. Am I describing something that's invisible? I could be. Maybe I'm just making it all up. Okay, so spiny. That's one thing. Okay. By the way, do you think this is round, flat?
It
3D.
looks,
Oval or round?
yeah, ovally.
Yeah. Okay,
Could be
round.
round.
Yeah, I agree. So if this is a roundworm, what phylum are we putting it in?
Nematode.
Nematode. Good. Okay. And then this organism, this thing over here. This structure, we have this structure, and then we have this structure. Both are characteristic of this. So you'll notice another theme here. We have these lateral cords. We've seen that in another organism. We have these cells. We have these hypodermal cells. We also, though, we have this thing, which looks like what? Kind of resembles what? If you were to put this in
Looks like a worm or a nematode of some sort.
Oh, yeah, it looks like a little baby.
well, this whole thing is the worm. So it has parts to it.
Is this like a
one.
colon? Is that
Okay,
like
good.
the mouth?
It's an intestinal cell. Yes. This is an intestinal cell. It has these little fibers over here, which have actin in them. They assist in actually moving it. They don't have, because these intestinal cells don't have their own peristalsis to it. This actually does have a thick muscular layer, and this is the esophagus. All those are features of a nematode known as gnathostomiasis. Gnathostoma. So this is gnathostomiasis. Spiny cuticle, very distinct esophagus, very distinct cell, intestinal cell. Okay. Oh, one thing I'll point out. Why didn't it run away from the inflammation like strongyloides?
Major basic protein again.
Because there's no EOS. Are there EOS? I don't see them.
Well, look, how large was strongyloides compared to this? There are EOs, by the way. Here's EOs.
Strongyloides wasn't nearly as large as this thing.
Yeah, it had. So what's going to have an easier time pushing through all this collagen and stuff?
The smaller.
Yeah.
Yes. This is way too big to outrun eosinophils. And so you see inflammation around it. Why didn't this run away from the eosinophils? This thing.
Was it because it was too slow, or
Well, even worse. Even worse than being too slow. It can't move at all.
so these were like implanted and then they're just not alive?
Yeah, and like, what is this is an egg with a spine. Of a fluke, a trematode. So what eggs have spines? Oh, you guys know this. You guys learned about this.
Hematobium.
What's up?
Hematobium.
Okay, schistosoma. Well, it's either, so it's either going to be one of two things. It's either going to be, if it has a spine and you're thinking that it's just not laterally placed, you're going to say hematobium. I think it's just, I think this is kind of artifacted, so it's laterally placed. If it's laterally placed, you're thinking what?
Mason.
Histosoma mansoni, and if it's not laterally placed, it's
Hem
hematobulum. And if it's like this, where it barely has any spine at
Monica.
all, then it's
Monica.
Schistosoma japonicum. Very good. And this?
It's
Notice
almost
how
like
those bug parts some of those bug parts just love staining yellow.
oh, I thought this would have been like a foreign body.
It is a foreign body.
Okay, like a splinter or something.
Well, does this look like plant material or bug material?
The teeth.
Uh,
Is it teeth?
Not really. I wouldn't describe it as teeth. You remember that spine that looked yellow? See how this also looks yellow?
yeah, so it's parasite.
Well, this is a tick bite.
Oh,
The tick part of it. Let's see. Tick bite, yeah.
okay.
Got really lucky on this one. They really got the tick part.
So the yellow stuff in that was the tooth, and then the
Well, I
darker.
wouldn't call them teeth. They can have like I don't know if I could call it a proboscis or but
But there was like that darker brown. I literally thought that was like the bug.
oh well, it's part of it. It is literally the bug. It's part of the bug.
Okay. Wow.
Now, usually you don't see this. Usually you're lucky when you see this. It's nice. Usually you just see the inflammation. Okay, what's this?
Tinea capitis?
Tinea capitis.
Or no, tinea, no, sorry, not sorry. Pediculosis capitis, my bad.
Well, how many legs does it have?
Looks like it has 8.
Yeah. Well, 8 legs. Hold on. 1, 2, 3, 4, 5, 6, 7, 8. Okay, 8 legs. What has 8 legs?
A spider.
So yeah, okay. So 8 legs. Cool. Does this looks like a spider to you?
No.
Yeah, spiders can have 8 legs. Spiders do have 8 legs. All spiders have 8 legs, but
Yeah.
something else has 8 legs also. What else has 8 legs?
It's like arthropods, or not even say.
What? Any arthropod? Like any? We agree. All arthropods don't have 8 legs.
Scabies?
Scabies, mites. Mites have 8 legs. So what? So that also means whether it's Sarcoptii scabii or Demodex follicularum or Demodex brevis, they're mites. They have 8 legs.
Got it.
So this is a middle oral prep. What do we do
Cool.
middle oral preps for?
That's for scabies, yeah.
Scabies, and here's the scibala. Here's the mite. Isn't that lovely? Here's the eggs, by the way. Okay. And here we saw onchocercosis, but here are the microfilaria of onchocercarial dermatitis. These can be very subtle. You can almost think this is like an elongated dermal dendrocyte or histiocyte. But it's not. It's a microfilaria. Okay, let's go to something. Ooh, here we go. So this looks similar to like the double barrel uterus, right? But we have something else in here. Instead of eggs, we have
Actual like babies.
yeah, like filaria. We have these larvae. So this is Wucheriasis. Yeah, Wucheria bancrofti in this case. So it's the double uterus, but it's eggs, then it's onchocerciasis. it's two uterus, but it actually has little swimmies, then it's Wucheriasis. Here's a, oh wow, this is beautiful. So perfect. I love it. Okay. What is it?
Looks like there's some maggot
Good. It's a maggot.
attachments again.
It's a maggot. And yes, this is another botfly, I believe. Dirophilaria hominis or myiasis. Yeah, probably from a botfly. Good. This is a better example. Look at these spines. Okay. Okay.
This is the actual worm.
The actual worm. Wow.
Love seeing that.
You're probably not going to see this on your exam. I'll skip to the point. This causes a B12 deficiency.
Oh, trepo something like the flat. It's a flatworm that you
Well,
get.
it is a
from,
flatworm. Good. And is it segmented?
It's trep. So no, it's non-segmented.
Well, here's a segment, right? Here's one
Yes, you're
segment.
right.
Here's another segment.
You're so right.
Okay, so it's a
Cestode.
cestode. And by the way, what do you see in cestodes? Look at this. See that? That's a what? Calcareal corpuscles for calcium homeostasis. Remember?
That's
Things with
stayed for
von Casa?
von Casa and alizarin.
Yes. So that's how you know it's a cestode. That's a little cheat code. Okay. This is what worm causes B12 deficiency? Does Diphilobothrym latum ring a bell?
Exactly.
There you go. Okay. We did this one. Okay, this was trichinosis. One last one. We're going to take a look at this. These eosinophilic globules with some basophilic stippling in them.
Splendor Hoffman.
Not the Splendori Hopley phenomenon. Definitely not. But this is a good example of what it is, of something.
It kind of looks like,
Is that the egg?
I don't know. I was thinking it looked like Malacoplakia for a second, but I know it's not that. Like some of the cells looked like Malacoplakia. I don't know.
Okay, well, what this is very characteristic. This is very round when you have a good one, and it has a little bubble, these little, looks like it have these little bubbly things in it, and there's a little bit of basophilic stippling in it. That's what it looks like from this power. Where it comes really cool is that sometimes, and this gives it away, but sometimes you could see it in the epidermis. So this is Toxoplasma gondii. This is toxoplasmosis. And these are called brevizoids. There's bradyzoids, sorry. Tachy and brady, like tachycardia, bradycardia. The big ones are bradyzoites. And the small ones with less organs are tachyzoites. And depending on certain conditions, they can shift between tachyzoid and bradyzoid. Anyway, that was our little wild world of Helminths.
That was really, I was very lost during that chapter.
This was a hard job, Avi. Thank you
Yeah,
for telling
thank you
us
so
this.
much, Avi.
Okay.
The fact that you know all of this about all of these obscure
Commendable.
things is very impressive.
It's- well, listen, this is what I do to get my appetite rolling, you know, when I need to eat. Which
Bon
actually
appetit.
we should all how about we all go get dinner right
Yes.
now? Should we do that?
Yes.
Perfect.
Good night, everyone. Thanks, Avi.
Have a good one.
Yes. Good night. Thank you, Abby.